What are the different stages of dementia or Alzheimer's disease? Dementia goes through different stages, and this is how it is. We can think of dementia as going through three stages. It is also important to know that the course of the condition varies from person to person, even if the cause is the same for a group of people. This is true even if the cause is the same. Five people with Alzheimer's disease may show five different clusters of symptoms, though they may all show some similarities. They may also get better at five different speeds early on. Most of the time, people start to notice some small changes. Changes in memory, ability to do things they used to be able to do without problems, or behavior could be the reason for the change in how they act. Sometimes people don't notice that they are getting sick because they think it was caused by a big event in their lives, like the death of a partner or a family member. Or it could just be because you are getting older. These may be seen. The person may have short term memory problems like forgetting messages and conversations, or he or she may repeat themselves. They may not understand something that they would have understood before. They may become more irritable and blame others for things that can't be found, or they may start to withdraw from people. There is a lot of need to find this stage and put it in as much help as possible, because the person needs to be able to keep track of things, feel important, and keep their own independence. This doesn't mean doing everything for them or setting everything up for them. Maintaining your ego and sense of self worth is very important. Early on, you can live well and enjoy life. This could last for years. Also, there may be drugs that can help, and the sooner they are given, if they are safe for that person and their type of dementia, the better. When we get to the second part of the book, which talks about how to deal with dementia, we will talk more about this. The middle stage. This is where the things from stage 1 become more clear. Disabling things will start to get worse, and it might be that the person is not able to do as many things every day. These people may not remember to eat or drink, or they may forget if they have had medicine or food. They might get confused about the time and think that night is morning and vice versa. They might get up at the wrong time, thinking that night is morning and the other way around, as well as forgetfulness. At this point, the loop phenomenon will become more clear than it was in the past. They may start to act in a different way. If someone changes their personality, they might become paranoid or suspicious. They might also get angry and be apathetic. They may not be very self conscious and stop taking care of their appearance. They might not be clean or dress in the wrong way. For example, they might mistake underwear for a scarf, put underwear on top of the other clothes, or put things on back to front. If you have dementia, though, there is still a time when you can live with dementia. These stages can also last for years. Disinhibitions. This is the name for not being able to control one's impulses at all. In childhood, we learned how to control our impulses and not to do things that we don't want to do. These kinds of inhibitions stop us from doing things in society that are not right. So, you don't reach out and touch a stranger, touch your own genitals, or spit in the street. You also don't swear at people or say things that are not right. When we have dementia, we lose the inhibitions that keeps us from doing these things. They might do any of these things because the parts of their brains that stop them are not working. Not something you should judge someone for. They can't stop it. What you can do is learn how to deal with their behavior, but not in a harsh way. The last stage. By this point, the person with dementia will need help and will probably need to be nursed every day for the rest of their life. Their memory may be so bad that they can't remember who their friends, family, or even their spouse are. They may not feel as strong as they used to. This could make it hard for them to talk, and they might not be able to speak. However, there may be times when they seem to recognize other people, which they will in fact do. though probably only for a short time. Some people may have hallucinations and delusions at this time. When someone has a hallucination, they think something is there even though it is not. They might hear voices or see things that are not there. As an example, someone might believe that someone is locked in a cupboard or that their grandfather is still alive. Because of a medical condition like a urinary or respiratory infection, or because they had surgery, someone with dementia might be in pain at this point. They may also be down. So it's important not to blame every change of dementia, because there could be another reason that is making them feel bad. It is important that the problem is found and that they get the care they need. It is likely that the person will become more frail as other parts of their body start to get older. They might not be able to balance well, so they might need help walking, like with a chair. They may need bed care when they are at their worst. Incontinence is becoming more and more of a problem because the nervous system that controls the bowel and bladder may not work as well. Nutrition and hydration are very important. Even though the person may not want to eat or drink on their own, having enough food for their body and brain is important. It is also important that they drink enough water because dehydration can make dementia worse by changing the body's electrolyte levels. That means that the levels of sodium, potassium, calcium, and chloride can all be affected by how well you are hydrated, which in turn can change how neurons send information to and from the brain. Important things. In general, people live 8 to 10 years after being diagnosed. There is less time to live if a person is older when they are diagnosed. When a person is 60, he or she may live for 20 to 25 years. When a person is 90, he or she may live for 2 or 3 more years. There seems to be a link between how long someone can live with dementia and when they were first told they had it. It is better to get the diagnosis made as soon as possible so that treatment can start right away. It also means that care can start right away to keep the person healthy. They die because they can't do things on their own and become bedbound and dependent on others in the later stages. They eventually lost the ability to swallow.